In this video, I'll be demonstrating how to perform a stretch to the upper trapezius muscle. You would obviously stretch the upper trapezius when the upper trapezius is tight, in addition to having possible posterior neck pain and scapular pain. And tight upper trapezius is associated with upper cross syndrome, chronically poor posture, stress and anxiety, and also individuals with chronic pain. To stretch the upper trapezius muscle, the patient will be seated with the stretched side hand behind their back, as you see here. Alternatively, they can also sit on their hand with the palm facing up. Either of those maneuvers is going to depress the scapula and help to give a further stretch to the upper trapezius. Also, because my left upper extremity is behind my back, I'll be stretching my left upper trapezius. So from this position, the patient can add the following progression of movements until a sufficient stretch is felt in the upper trapezius on that side. Cervical flexion is first, followed by contralateral cervical side bending, followed by ipsilateral cervical rotation, and then ending with cervical retraction via activation of the deep neck flexor muscles. Now, because we're doing cervical flexion, which takes place in the sagittal plane, and following it with side bending that takes place in the frontal plane, there's not going to be a lot of motion left for this cervical rotation, so you may not have a lot of this remaining. And that's via Freete's third law, which we cover in a separate video. Let's take a look at it. Cervical flexion, contralateral cervical side bending with that overpressure, and then there's really not a lot of rotation left, but it'd be ipsilateral rotation with activation of the deep neck flexors giving some cervical retraction, which further stretches the upper trap on the left side. And you would hold this stretch between 30 and 60 seconds per side. Cervical flexion, contralateral side bending, ipsilateral rotation, and cervical retraction. Also note that specific trigger points within the upper trapezius muscle can be relieved by localized deep pressure manually or with dry needling. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.